I'm Diane Slocumb, Director of Surgical Services, which currently encompasses the OR, Central Service, as well as outpatient and PACU. We offer a huge line of services for the community, with the exception of open hearts and burns. We usually ship those to the hospital that do them well and do them a lot. We have a total joints on Monday. We have a total joint camp that does exceptionally well, gets them home earlier. They're in less pain. They use less pain medication, and they're up and walking much quicker. We do anywhere from 4 to 8 of those on Mondays. A few more on Tuesdays occasionally. So our orthopedics is a huge population of our patients. We also have a very busy general surgery group. They do almost 50% of our surgeries. We have some surgeons who specialize in doing the fistulas for the diabetic and the dialysis patients. We do a large amount of urology also, and a fair amount of GYN surgeries. What we don't do a lot is pediatrics. We only have a small population, but we're hoping to grow that. We are getting more and more ENT cases, so we're looking at getting more equipment for that. We have 5 rooms we book. We do have capabilities to run 6, so we use that 6 room sort of as an overflow, or try to catch up the schedule, decompress the busy schedule. For the 5 rooms we have done 500 cases about four times this year. That is a large amount of cases to do in 5 rooms. I will think that in the system, not very many hospitals can do that many cases in 5 rooms. We have an excellent team. We have certified nurses. We have certified techs. We have new computer systems for computerized documentation. We have computerized tissue management systems. So we have a lot of high-tech equipment back there. It takes a lot of training. The average orientation for an OR nurse is at least 6 months, if not longer.
Orientation is 6 months?
Yes, because of the sheer amount of types of cases we do, the complexity of the cases, the equipment. They have to know how to run all the equipment. They also cover calls, so they have to be able to do all services. It takes quite a while. This is the 5th hospital I've worked at, and I will say that the level of expertise of these surgeons is exceptional. Not just because I work with them, but I have seen many, many other surgeons. And the nice thing is, for the most part, they treat and work well with the staff. They are always looking for seminars to go to learn the newer and better ways of doing it. On the backside, usually that costs me more equipment and supplies for them, but that's okay. Orthopedics, general surgery, urology, OBGYN, they're all exceptional. We can do probably most surgeries without having to go to, Charlotte or Duke. But we know what we can't do well, and we make sure that if it's something that we're not comfortable with, we will get you to a place that does it often and does it well.
It's always patient needs first.
Patients first. Safety is first. We are a patient safety oriented. We do, our timeouts are mandatory. Dr. James has an excellent technique he uses. I think he picked up in the military. It is absolute first of everything. Staff safety comes second. We make sure they have all the safety tools that are needed.
Contrast this place to the places you've worked before.
The previous hospital I worked at was in Michigan. It was a little bit bigger hospital, but it was in a town about the size of Shelby. It was the only hospital in town. Excellent surgeons there. I don't think they had anything over Shelby. I did work in a rural hospital in Montana. The biggest hospital was in Virginia, and it was, 20-some years ago, so it's hard to compare that one. I don't think Shelby has any less to offer than any of the other hospitals.
Why did you choose to come here to work?
It's warm here. No, I was looking to relocate. I had finished my master's degree, and they were looking for a director, well, at that time, a clinical coordinator in surgery. So I came down and interviewed, of course, fell in love with the area. I like the hospital. I like the way it responded. It's friendly, but it also looked toward the future, looking at what's going to come down the line shortly.